Hello, Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about something that should have been freaking obvious from the very beginning of this entire COVID lockdown thing. And certainly I'm not the only one who's been saying this, but it needs to be said again and again and again. Something we need to understand is that the number one killer in the United States still, by far, not even close, is cardiovascular disease. Last year alone, 2019, we lost 647,000 people to cardiovascular disease. That dwarfs the number of deaths from COVID. So what does that matter? Because heart disease we can prevent. We have medications, we have surgeries, we have blah, 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 blah. And for COVID, we don't have a vaccine, we don't have any treatment. But we do know what makes COVID worse, and that is cardiovascular disease. And guess what makes cardiovascular disease? The psychological stress associated with the lockdown and downturn of the economy. So this particular study in the American Heart Journal actually puts it all on the line, talks about how devastating it is to the cardiovascular system, and puts some numbers to that, and also gives some ideas of what we might be able to do to help mitigate or to protect against the cardiovascular damage of social isolation and the lockdown. To put it into perspective, we've said it before that physical isolation and cardiovascular disease are very strongly connected. No doubt, no argument, period. And poor social connections have been shown to increase cardiovascular disease risk by 29%, stroke risk by 32%. Those are pretty significant increases in risk. So without a doubt, the very actions that we've taken to lock down the community, social isolation, depression, drop in socioeconomic status, people losing jobs, losing homes. New York, from everything that I continue to read, is just a wasteland and just continues to get worse, not because of the virus, but because of the reaction to the virus. So the authors of this article in American Heart Journal give 5 suggestions for us to, or for our cardiology community to rise up to this. First one is to add social contact, social isolation to the risk assessment for cardiovascular disease. The risk of social isolation is bad enough that we should throw it in with things like cholesterol, high blood pressure, smoking, everything. So making that a part of a standard questionnaire, if you will, for determining whether somebody's at risk of heart disease or not. There's a definite association between social isolation and blood pressure. So making sure that we are monitoring blood pressure. So are people's blood pressures going up at home merely because of the social isolation? And we should be monitoring our blood pressure more at home to keep an eye on that. So that was a second recommendation. Third one had to do with increased stress. We see increased not only substance abuse, but smoking. So smoking, without a doubt, increases risk of cardiovascular disease, but the stress associated with that, people have a tendency to turn to what we would call hedonistic behaviors. So poor eating, lack of exercise, and things like drinking, drug use, and cigarette smoking. So the other third suggestion was to monitor for increase in cigarette smoking and continue to move forward with smoking cessation efforts to get people to either not increase, not start, not return to smoking during social isolation. The third one is diet. Wow, this should come as a big surprise. Make sure that we should be making healthy choices during social let's just say the lockdown. That we should be paying attention to our diet, which is exactly the opposite thing people have been doing. Fast food franchises are continuing to rocket during the pandemic makes no sense at all. I don't understand. We should be taking better care of ourselves. We're not. But they're suggesting as the fourth idea is to make sure that we pay close attention to a good heart-friendly diet. The fifth one, ironically enough, is talking about exercise to help, again, mitigate or protect against the damage from social isolation. And the kick in the ass in that one is it's harder and harder to get exercise. Gyms are closed. You couldn't buy exercise equipment to save your life. Here in Arizona, working out outside in the summer is now just short of impossible. But the cardiology community is recommending that people exercise more, which they are doing less of because all of those options have been restricted for people by the measures that we're taking. So one thing we need to understand, and people just don't seem to get it through their thick head, that our response to the virus has been far more dangerous to the health of our community than the virus itself. If we lose 647,000 people, if we lost 647,000 people last year to heart disease, and we're worried about a virus that probably won't top 200,000 for the year, but our response to it is going to increase the risk factors for what is our number one killer, that makes no sense whatsoever. So as always, I will post a link to this particular study in the comments section, and make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.